This is our open enrollment presentation, which is going to be hosted by the Nevada Premium Assistance Program. Marketplace open enrollment for 2019. It starts November 1st, and it goes all the way until December the 15th. And their coverage will begin January 1st of 2020. And this is for anyone that is enrolling on the on and off marketplace plans. Medicaid and Medicare open enrollment for 2019 begins October the 15th for Medicare, and Medicare open enrollment ends December the 7th for a January 1st start date. Medicaid enrollment is all year round. The plans that the Nevada Premium Assistance will cover, we will cover on marketplace insurance plans, plans available through the Nevada Health Link that are eligible for low income subsidies, which are determined at 139 to 400% of the federal poverty limit. And what we're talking about with low income subsidies, we're talking about the advanced premium tax credit. We will also purchase approved plans for the off marketplace, and these are plans through the Nevada Health Link that are not eligible for low income subsidies, aka the advanced premium tax credit. The program will also pay for Medicare Part C premiums, which is our Medicare Advantage plans, and our Medicare Part D plans, which is the Medicare prescription coverage plans. The program also covers employer-sponsored insurance plans for eligible members that accepts third-party payments on behalf of the employee. When we're dealing with employer-sponsored plans, we only cover the portion of the insurance in which the employee pays. So if you are currently employed at the state of Nevada and your portion of the insurance premiums that you would pay is $139, the program will pay that $139 if the program accepts third-party payments. If the employer does not accept third-party payments, the client must still enroll in their employer-sponsored plans. And this is part of our payer of last resort. So if an employer offers an insurance plan in which it has been determined to be cost-effective for the client, meaning that their income their premiums is not 9.9% of their premiums, then they will have to go ahead and take that employer-sponsored plan. Plans that Nevada Premium Assistance will not cover. We will not cover associated health plans. An AHP is a health insurance for a group purchase through an association or a group of entities. The group may self-insure or may hold a group policy. In the past, associations have typically been comprised of small businesses, typically with a common professional, industry or trade interest or state or local chamber of commerce. A lot of these plans are not ACA compatible, and they do not have a lot of the ACA requirements. Therefore, the program will not cover associations. We also will not cover short-term disability plans. Short-term plans provide coverage for a short period of time and are not required to be renewed. Automatic termination at the end of the contract. They also do not require to provide essential health benefits, including prescription coverage, and can deny coverage for pre-existing condition. So for those reasons, we will not cover a short-term plan. Also, it only, with the new rules, I think it's 364 days in a year is what you have to be on a short-term plan for. These plans can also impose lifetime and annual limits. So that means that once they reach their cap, so if they're saying that I'm only going to pay you $500,000 in benefits, once they hit that $500,000, you will be responsible for the full cost. COBRA and premium assistance. For those clients currently eligible for the Nevada Premium Assistance and they are on COBRA, they must enroll in a marketplace plan during open enrollment. It's critical to remember that clients that meet a life-changing event have 60 days from that life-changing event to select a marketplace plan. That includes a loss of jobs, relocation to Nevada, births, deaths, marriage, divorce, adoptions are just examples of a few of the life-changing events. The marketplace may require documentation supporting these life-changing events, i.e. termination of job, a death certificate, and divorce paperwork. So it is critical that we are explaining this to our consumers. Clients categorically ineligible for marketplace plans / Medicare may be eligible for off-marketplace plans, and we'll talk about that a little bit later in the presentation. Medicare and premium assistance. If a client is eligible for Medicare Part A and Part B, they are eligible for premium assistance for Medicare Part C and D plans. Medicare clients are not eligible for an on or off marketplace plan because they are eligible for Medicare. If a client is eligible for Medi-caid, they are not eligible for premium assistance for an on or off marketplace plan. Clients that are Medi-caid eligible must enroll in Medi-caid. So health insurance for the auto-enrolled plans. So this is for consumers who are currently enrolled in the marketplace right now. So if a client is currently enrolled in a 2019 marketplace plan and they do not select a new plan for 2020, the health insurance marketplace will either enroll them in the same plan for 2020, or if the plan is not offered, they will auto-enroll them into a similar plan. As soon as the client selects a plan for 2020, the auto-enrollment feature is turned off. Auto-enrollment will take place on December 16th of 2019. So for those consumers who are currently enrolled and they do nothing, they do not set up an appointment with Access to Healthcare Network, they will automatically be auto-enrolled into their current insurance plan. If a client is eligible for an on-market plan as of September 1st, 2019, a letter has been sent to each of them requesting the following information and actions be taken. The client must contact their insurance carrier for both their medical and dental insurance plans, if applicable, and confirm that the premiums are current and that there is no overdue balance that may impede their enrollment in the 2020 plan year. Clients must also transfer their healthcare.gov information to the new state-based exchange via Nevada Health Link. The form provided by the Office of HIV in the mailing must be completed, signed, dated, with a copy of their September and or October premium invoices and returned to Access Healthcare Network no later than yesterday, October the 15th, 2019. As of November 1st, all premiums will be paid throughout the end of the 2019 calendar year. Once the 2020 premium documentation is received from the clients, they will be re-enrolled in the Nevada Premium Assistance Program. Now, I know I'm going through that a little bit quickly, and I know there's probably quite a few questions that are going on about that, so we will touch questions here in a second. So John Doe is eligible for the Nevada Premium Assistance Plan in 2019. John enrollment started on September 1st of 2019 and will expire February 28th of 2020. The Nevada Premium Assistance Program will pay John's current plan through December 31st of 2019. This payment will be sent before November 1st of 2019. The client will be closed out of the Nevada Premium Assistance Program for their 2019 insurance, as we have already paid it up until December 31st. Once the new 2020 enrollment information is received from the client, they will then be re-enrolled into the Nevada Premium Assistance Program for the new 2020 plan year. So we have asked that all of our consumers bring in all of their insurance information so that we can pay their premiums throughout the end of this year. It is very important that the Nevada Premium Assistance Program is provided information regarding all insurance enrollment. The Nevada Premium Assistance Program will be closed out once the December 2019 payment is sent. If no 2020 insurance information is received, the clients will remain closed to the Nevada Premium Assistance Program and no 2020 payment will be sent. It is the responsibility of the consumer to bring in those premium payments so that we can go ahead and get those premium payments started. Nevada Premium Assistance Payment is doing this to avoid the misapplication of premium payments. The program does not want the 2020 binder payment being applied to any 2019 premium payments. Example, if a client enrolls themselves into an approved plan but does not bring in their invoice, 2020 payments will not be made on the client's behalf, and the client is going to be responsible for those premium costs until he brings in those premiums. The Nevada Premium Assistance Program will require individuals at the point of selection of their Nevada Marketplace policy to elect the advanced premium tax credit if eligible. Clients that receive the advanced premium tax credit must file taxes during the upcoming tax season, and they must reconcile their advanced premium tax credit during that tax preparation. Nevada Premium Assistance clients that receive the advanced premium tax credit can file their taxes with the assistance of a voucher program if still eligible for the Ryan White program at the time of filing. We are currently contracted with Access to Healthcare Network to provide tax preparation services to clients who are currently receiving the advanced premium tax credit so that they can reconcile those taxes each and every year. So our tax reconciliation example, in 2018, John has a monthly premium of $642 and an advanced premium tax credit of $242, which means that as a Nevada Premium Assistance client, our program will pay the $400 for John's monthly premiums. In 2019, John files and reconciles his taxes and finds out that he should have received an advanced premium tax of $342, which means the program should have paid only $300 a month instead of the $400 a month, leading to a difference of $1,200 over the course of 2018. Due to the fact that the Nevada Premium Assistance Program has paid more than it should on John's behalf, the government will include a refund. And when we're saying the government, we're talking about the IRS. We're not talking about the state. Will include a refund for the overpayment when John receives his tax refund in 2019. John receives a tax refund of $3,400 total. Of that, $1,200 is for the advanced premium tax credit overpay. It is John's responsibility to forfeit that $1,200 of the tax refund to the Nevada Premium Assistance Program because that is the amount that the program overpaid for his monthly premiums in 2018. So we're going to talk about what should take place during a pre-meeting with a case manager. And this is specifically talking about consumers who are currently enrolled on the advanced premium, currently enrolled on the marketplace plan. The case manager should check the client's paperwork, they should check the accounts, and they should also make sure that the payments are current. They should review any insurance documentation and identify any outstanding payments or credits. The case manager and client should place a call to the client's current insurance carrier to to determine if there is any outstanding balance on the client's accounts. They should confirm They should confirm insurance enrollment appointments with access to healthcare network so that we can get the client enrolled in a 2020 plan. They should help the client prepare for open enrollment appointments, help client organize insurance and marketplace paperwork. That would include any residency requirements, that would include any tax paperwork, that would include any paycheck stubs, so that we can assist the client. They should also assist the client in transferring their healthcare.gov information to the new state-based exchange, the Nevada Health Link. This is very, very crucial. If the client has not, transferred their information from healthcare.gov, they need to do so immediately. That information needs to go over to the Nevada Health Link so that they can merge that client's information from healthcare.gov into our state-based insurance exchange. Clients should be informed that the Nevada Premium Assistance Program will only provide assistance for approved plans. Do not sign the consumer up for a plan until they are approved and the plans have been announced by the Office of HIV and AIDS. We strongly encourage all consumers to utilize the Nevada Premium Assistance Certified Application Counselors currently located at Access to Healthcare Network to enroll into any programs, insurance programs that have been approved by the that has been approved by the Office of HIV. If a client selects a plan that is not approved by the Nevada Premium Assistance Program, the client will be responsible for those costs. We will only pay for the plans in which we have approved. Clients may use online web brokers, but must know that they will not be aware of our approved plans, and they will not have the ability to communicate directly with our program. The program does not and cannot require a consumer to solely use our program for enrollment into the marketplace. That is 100% the client's choice. And if they choose to go outside of the program to enroll in the marketplace plan, they can, but if they select a plan that is not approved, the program will not pay for it. So our pre-meeting tune-up, we want to ensure that clients who are eligible to receive the advanced premium tax credit have filed their 2018 federal taxes so that they remain eligible for financial assistance. Estimate clients' income and update CareWare with any changes to avoid any under or overpayment of the advanced premium tax credit. Just in the example that we gave with John, John owed the program. But if we did not have the updated information, then the program could potentially owe the IRS on John's behalf for that income that we did not pay for. So we want to make sure that we are putting in the most current and most accurate information. So please update CareWare with any changes that a client may report to your agency. We want to ensure clients are eligible for employer-based insurance. We want to ensure to follow up with their employer HR department to determine when their open enrollment dates are. If a client is eligible for employer-based insurance and it is cost-effective for that client, they must enroll in that insurance plan. They cannot be on the advanced premium tax credit. They may be eligible for it. Not the advanced. We will not be allowed to pay for their premiums for any on or off marketplace plans. This is going to our payer of last resort. So if there is another payer source via their employer, they must select their employer-based plans. Be sure that Access to Healthcare Network has all updated contact information for the client. This includes mailing address and telephone numbers. When we're dealing with insurance, the insurance needs to go to a mailing address. So even though the consumers could say, I do not want mail coming from you, they will need to have a mailing address for the sole purpose of getting their health insurance mailed to them. And it must go to their mailing address. It cannot go to an agency. So cost effectiveness and plan selection, we really wanted to go over how we select plans and be a little bit transparent. So HRSA allows for us to make payments for health insurance as long as it's cost effective, and it's more cost effective than paying for the full price of the medication. So we're going to give you an example because it's better to give you an example than it is for me to go through all of the Excel spreadsheets that we have to go through in order to select our plans. So the client is 42 years old. He's a smoker and he lives in Clark County. We have selected, or we're looking at the HPN Silver 9 plan. The annual cost of that plan for his premium payments is $5,615.52. That's for the year, plus his out-of-pocket max. So this is the most that this particular client would pay for medications, doctor's appointments, anything that is related to his health insurance. This is the most that this client will pay out of his own pocket. And that is $8,150. So what we do is we add the annual premium cost, the $5,600, and the out-of-pocket max, which is the $8,100, together, and we say, is that cost cheaper than for us to pay for their antiretroviral therapy medication? On average, we spend close to $16,745.22 a year for medication for a consumer. So we added those two together and we found that it costs less for us to purchase this insurance plan and pay the out-of-pocket max than it would be for us to pay the full out-of-pocket, the full medication cost for his anti-therapy medication. So that is how we selected the HPN Silver plan. Or we selected all of our plans. So this is the 2020 approved on and off marketplace plans. Anthem Silver Pathway X HMO 3000, Anthem Silver Pathway X HMO 2000, Ambetter Secure Care 5 Gold, HPN Silver 1, HPN Silver 5, HPN Silver 7, and HPN Silver 9. These will be the only on or off marketplace plans that the program will pay for in the 2020 calendar year. I will leave those up for a few more seconds so you guys can write those down. So the enrollment site for the Nevada Insurance Marketplace, we want you to remember we are no longer using healthcare.gov this year. We are using the Nevada Health Link. We switched from the federal exchange and now we're on the state-based exchange. So it is very, very important that if you're talking to consumers and they say, I want to do it on my own, inform them if you want to do it on your own, you can, but do not go through healthcare.gov. You want to go through Nevada Health Link. You are able to enroll in a marketplace plan from November 1st to December 15th. If you're enrolled in a plan by December 15th, your coverage will start January 1. Again, you want to visit the website, which is www.nevadahealthlink.com. Here is the help desk. So if you have any questions or your consumers have any questions, please give them that number. The exchange, they are very friendly. They are very knowledgeable. They'll be very helpful and answer any questions that you or the consumer may have. And they are open Monday through Friday, 8 a.m. to 5 p.m. And now I am going to pause there and see if we have any questions. Zosha?
Hi, Thomas. It doesn't look like we have any questions just yet.
So the good question. So your pre-meeting with caseworkers, this would be anybody who is on this call that is meeting with anyone prior to open enrollment. We're really trying to link that to people who are currently on the marketplace plan. And Zosha will talk about this a little bit more when she's talking more about the Excel sheets. But for those who are currently working on our uninsured plan, we want to make sure that they're bringing in the information that is needed, the residency information for the Anthem plan. If they're going on the Anthem plan, we want to make sure that they're bringing in their paycheck stubs if they need that for, like, if they're eligible for Medi-caid. We want to make sure that we have all of that information so that if that consumer, when that consumer walks out of that appointment, that consumer is in an insurance product. And we'll talk about that a little bit more when Zosha comes up and presents.
Alrighty.
Like, if you just want to unmute your mic real quick and ask the question before we get all that's fine.
Does anyone have any questions they'd like to ask before I hop in?
Are you going to send a copy of the slides out?
I am recording this, so we can I can have Zosha put this onto our website.
Thank you.
An EEF, that is an enrollment facilitator through the marketplace, which is a little bit different than a case manager. The case managers for the Ryan White program would be our non-medical case managers. So the EEFs are the really, we should call them the CACs, which is our certified application counselors at Access to Healthcare Network, that will be helping people enroll in their insurance plan. Good question.
Okay. Does anyone else have any questions for the time being? Okay. So let's go ahead and jump into the spreadsheet. So for open enrollment over the next couple months, last week each agency participating received an email that contained the letter that we sent to our uninsured population, a list of about 115 clients that they'll be reaching out to schedule for their enrollment appointments, along with talking points to assist case managers when making phone calls with clients. Each agency has also been assigned a state worker who will monitor their open enrollment efforts, provide any assistance that they may need, and they will be having weekly calls with them. So the letter that we sent to our uninsured population contains information regarding what plans we have selected, along with required documents that are needed during the client's open enrollment appointment. So just some information that the client will need to bring with them to their appointment is going to include their state ID or other form of identification with their picture, acceptable forms of proof of residency, which include a recent utility bill with their current address, a signed residential lease or contract, living assistance residency documentation, a current driver's license with a Nevada address, etc. And along with that, if they could also bring a list of medications or their primary care physicians or specialists, along with clinics and hospitals that they currently see. So for those agencies that are participating, some of the clients on the list that you received are highlighted, and this means that they need to be contacted via email instead of called, or you would need to connect with that client's eligibility agency in order to contact that client to schedule them. Our goal for open enrollment is to have 90% of the clients on each agency's list enrolled into health insurance by December 15th. To make sure we reach this goal, each agency will be having weekly calls until the end of open enrollment with their assigned state worker. If you have not provided your assigned state worker with a date and time for your weekly calls that you are available, please go ahead and do so today. Also, please be aware that some clients on your list reside in counties different from that of the AHN remote enrollment worker's location, which means that those specific clients would need to be scheduled for phone appointments. So these are going to be clients on your list that are located in a different location than where the AHN enrollment worker is located. So say, for instance, you have an AHN worker in Vegas and the client's located in Reno. That client would need a phone appointment. And also, some clients just want phone appointments. They don't want to come in person. And so if this is the case, please include phone appointment in the notes tab that you can see here on the spreadsheet, along with the client's phone number. We expect that all clients on the list to be contacted weekly until they are scheduled for their enrollment appointments. Case managers will only know that a client has been enrolled onto health insurance once the AHN enrollment worker codes that client cell green in the spreadsheet. Okay, it looks like we have a question. It says, what if our entire list is located in Clark County, but the enrollment worker is in Reno? So then those clients would need to be scheduled for phone appointments. Hopefully that answered your question. Okay, so for this project, we have the Google Sheet here, and it is a live document that all caseworkers and AHN enrollment workers have access to and can edit. So when assigning a client to an available cell, please input the client's URN, any important information that the AHN enrollment worker should know for the appointment, and the client's phone number. If a client is coded green, that means that they have been enrolled onto health insurance. If a client is coded yellow, that means the required paperwork, which has been stated in the letter that is attached to the emails, that is needed to enroll the client on health insurance is still needed. And the assigned agency case manager would need to follow up with that client in order to obtain that paperwork and get it to AHN. If a client is coded red, that means that the client no-showed for their appointment, and the client will need to be contacted so that they can be rescheduled. Only AHN enrollment workers should be using the colors red, yellow, and green. Assigned agencies are only to code a client blue when they are taking an appointment from a different agency, because that is the only date or time that the client is available. So say, for instance, the case caseworker for accept needs a specific appointment that only HOPES has on, say, Friday, November 8th at 8:30 a.m., then you would input the client's URN in this box right here, and you would code it all three cells, the client URN, the notes, and the phone number. You would code it blue. And in the notes, you would provide a justification. Only date and time client would be available for enrollment appointment or something to that effect. So say for instance, so this would typically be the only instance that an agency would use the coding for blue. And so for instances other than that, please just stay out of other agency spreadsheets to avoid confusion or accidentally inputting your client's URN into a different client's spreadsheet. And also, please do not edit the dates and times. And on the spreadsheet itself, if you guys look up in the top right, we have these anonymous icons. If everyone could input their name so that we know who's what, that would be greatly appreciated. And there was a question asked on how to input careware notes for consumers that is not in an agency's domain. So you would just go ahead and input that consumer into your domain and begin inputting careware notes that way. So this is the spreadsheet right here, and our 7 agencies, along with their assigned age and enrollment worker, along with the legend, the instructions, and some general information. Say, for instance, like the case manager wants to ask a question to the age and enrollment worker, vice versa. There are emails to contact each other. Okay, so it looks like we have some questions. So we have a question from Lori at SNHD. It says, if a patient has no residency and it cannot be sent to the agency, what other mailing options are available so that the client is able to get his insurance card?
Are you throwing that to me, Zosha?
Yeah, I'm going to throw that one to you.
So, for the most part, what Vanessa did when she pulled the list is she pulled all of our true homeless individuals out. Those were the individuals who were currently, living on the street, under bypasses and things like that, that truly do not have an address. For those who are just couch surfing, this is not going to be information from the Office of HIV. This is not going to be information from you. We would need a mailing address that consumer would feel comfortable receiving mail at, and just let them know that, hey, it's your insurance card. It's not any information that's going to tell anybody what your status is. It's going to be, here is your Anthem Blue Cross Blue Shield card, here's your member's number, here's your provider information. And so that is the information that we would need, and that they would need a mailing address for.
Awesome. And I see a couple questions about how do you know where your age and enrollment worker is. That was included on the email that was sent out last week. It should be in the last paragraph, and it'll say either AHN Reno or AHN Vegas office. Okay, it looks like there's a bit of confusion on the blue cell. Okay, so typically, say for instance, Karina at Accept, say you had a consumer that doesn't fit or can't use any of your available appointments. So you would look over to the HOPES tab and see if they have any available appointments, or only the available appointments that client needs. So say for instance, this client can only come on November 7th, that Thursday from 1:30 to 2:30, and that is a slot that you don't have on your own spreadsheet. Then you would go ahead, so long as the cell is still empty, you would enter the client's URN. In the notes, provide this is the only date time the client could be scheduled for their enrollment appointment, and then you would also the client's phone number and state whether it is a phone appointment only or if it's going to be an in-person appointment. And you would code these cells blue so that the worker at Hopes knows, okay, why is this random, how did this client get here? And then they can look through the notes and from the color tell that, oh, another agency needed it because this is the only date/time that was available for that client. So hopefully that cleared that up a little bit more. If not, I can reach out to you afterwards and we can go over it. So I see another question. What if no email or phone number are listed? Are we talking about the client's phone number or email? Yes, the client's. That information should be on the list. If it is not, please reach out to your assigned state worker and you can work with them to find a way to contact that client. Okay, so there's another question. Sorry, Thomas, were you going to say something?
Mm-mm.
Okay. So I have another question. When we are getting their state ID, proof of residency, list of meds, etc., since it will be a phone appointment, are we telling them to email all of this to our assigned case manager? So yes, the letter that was sent out, a client can send their paperwork to Access to Healthcare Network either via email or fax, and that information is on the letter that was provided. Thomas, would you know specifically about the specific case manager's email?
So on the letter, I do believe that we put Access to Healthcare Network's Ryan White email that they have set up.
Right.
And they could send that information to that email address. Or they could come into any agency that is funded through Ryan White Part B and drop that information off and make sure that we're getting that information over to Access to Healthcare Network as soon as possible. So the turnaround, I know everybody is on their 3-day turnaround for CareWare information, but this is critical that the information gets to Access to Healthcare Network as quickly as possible so that those binder payments can be made before December 15th. If the binder payment is made after December 15th, there's not a guarantee that that consumer's health insurance will start on January 1, and there's also not a guarantee that that consumer will also be enrolled in health insurance. So we want to make sure that we are giving the client as much option as possible to get into get that information over to Access to Healthcare Network. Also, and if they need to, they can drop it off at Access to Healthcare Network. The address is on the form. They can fax it. The fax numbers are on the form. Yeah. So any way that they can get that information to them as quickly as possible, that'd be great.
Okay. Thomas, it looks like there's another question here. What if a client has Medi-caid already?
Then that's great. There's nothing that we need to do. So I would just mark that in your service notes, contact the client has Medi-caid, and then we should have that information uploaded. But there should not be anybody on your list that has Medi-caid, because our CareWare now has all Medi-caid eligible clients coded as Medi-caid eligible. So the list that you receive should not have any Medi-caid eligible people, or people that are currently receiving Medi-caid. If so, just talk with your state appointed person and we will figure that out.
Alrighty. Does anyone have any other questions for us? Or any questions more so specific to the PowerPoint? You can also type your message or unmute your mic and ask it if you'd like.
Hi, this is Karina with Accept. Has this spreadsheet already been sent out? I haven't seen it or received any access to it yet.
Yes, all emails were sent out last week. And just so happens, I'm your state worker, so you and I can connect and see what happened there. Yeah, but they were sent out last Thursday.
Okay, thank you.
Alrighty. Anybody else have any questions?
Well, it seems like Francis is typing up a question, so we'll wait for Francis.
Okay.
Or Francis, you can just unmute your mic. Okay. Well, I just want to end this by saying thank you all so very much for all of the hard work that you have done over the year, over this grant year, and all of the hard work that you're going to be doing moving forward. I just want to thank you for helping us reach our goal of getting 90% of all of our consumers on health insurance. Just to give you in with some data, we have a little over 89% of our consumers that currently are enrolled in health insurance are virally suppressed, while in the mid 70s, I think it's like 77% of our consumers who are uninsured are virally suppressed. So we know that by putting people on health insurance and getting them on health insurance, they're more likely to get the care and the treatment that they need. So you guys are doing some great and awesome work. So on behalf of the Office of HIV, I would like to say thank you so very much for everything that you're going to be doing during this open enrollment. And please reach out to your assigned state worker if you have any logistical questions that they can be able to assist you on. We want to make sure that you have as much technical assistance as you need in order to move this process forward.